Good afternoon, everybody. We're just going to wait um, for another few minutes. Hopefully, we will be starting soon in the next, I would say, 3 to 5 minutes. Thank you, everybody, for joining. Hi, Dr. Brown. I think you're on mute. Dr. Brown, you can hear me?
I hear you well. Do you hear me?
Yes, I think I'll just increase my voice here. Just for everybody's perspective, we are recording this conversation. I'm joined here with Dr. Brown. I'll ask him to introduce once a few other people have joined. And I know we are a couple of minutes early anyway, so we'll just allow everybody to join for the next couple of minutes, and then we can get started. Okay, excellent. Hey, everybody again for joining. I see there's a few people on the call. I guess a few other people are joining. So why don't we get started just in the interest of time and respecting those who have already joined. Hi, everybody. This is Naman here, Naman Jaffer. I'm the founder of, Peniscripts and of Marketech. So today is not about what we do. It's all about yourself, and we are extremely thankful for everybody for joining at this time. I'm joined by Dr. Brown, Dr. Michael Brown, who will introduce himself. I'll pass it over to him, but before we do that, I just wanted to kind of level set what we're going to capture in the next 40 to 45 minutes. Our first presenter would be Dr. Michael Brown. He will, as I said, introduce and talk a little bit about AI in and how it's impacting mental health. And then in about 20 to 25 minutes, I'll pass it over to another colleague of mine, Michael Lloyd, who has a very exciting time render with us. And he will take about 10 to 15 minutes to talk with how artificial intelligence is impacting their clinic and their practice. And then we are keeping about 10 minutes at the end for any Q&A. So just before we start, again, if you guys have any questions, we have a number of questions. Of course, when you signed up and registered, we have a slide where we have tried to summarize, and we'll try to answer those questions as much as we can. But again, just before I pass it over, this call is being recorded. Please keep yourselves on mute. And if you have any questions, please put it in the chat window at the top, bottom right corner. There's a chat window, and I'll try to make sure that most of your questions are answered. So without further ado, I'll pass it over to you, Dr. Brown. So go ahead, please.
Hi, everyone. Thank you for joining today. I'm thrilled to have the chance to present to you. I'm an internist by training. I somehow became the Chief Information Officer for Harvard University Health Services, and then taught at the Harvard School of Public Health, particularly around health IT and things of that nature. So I'm excited to share what I know. I'm trying to present today a topic related to what I think every therapist should know. There's a revolution happening in AI, and I think it's for all of us to know about it and figure out how we're going to be involved in it. So let me start and get going. So I broke the presentation into 3 parts. First, I think it's good for everyone to understand what is AI. The second part is applying AI to healthcare with a particular focus on mental health. And the third is the ethical considerations. And actually, I beefed that section up a bit because when I saw the interests of what people wanted, ethics seemed to be one of the things that was a major interest. So I'll try to spend some time on that as well. Disclosures, I work with CliniScripts on their ambient note dictation system. All right, so in terms of understanding AI, the way I like to think of it is 3 types of AI. There's the old school AI, and there's machine learning, and there's machine learning and big data, and then there's machine learning, which is generative AI. So I'll discuss all 3. Okay, so in terms of the old school AI, it's basically a bunch of rules. Just slightly missing. It's a bunch of rules, and it's basically that experts basically sit down and decide things. It's if in your old, you might have had classes in school where you learn a little bit about computers with if-then statements. It's a lot of that sort of stuff, and it works, but it has its challenges. And we do use them for expert systems, but the new technology does a lot more. You have to decide for this old school AI who your experts. You have hard cutoffs, such as, let's say, a blood pressure of 70, whereas blood pressure of 71 or 69 may be a different category. You have to figure out how the rules are maintained as they change over time. And most of the rules tend to have things in them at some point saying that aren't detailed enough, where it says at the discretion of the clinician. The second one I'll talk about is a big data and basically categorization of data. So this is involved in looking at the raw data itself, not so much asking experts what they think, but looking at the data. And this is a graph of comparing things on 2 coordinates and trying to figure out how do we draw a line that separates those 2 so that we can basically classify systems into being one or the other. And so when new things come in, they get divided up accordingly. So there are rules in here, but the computers are kind of figuring out the rules. They're figuring out how to make the distinctions between things. And again, this obviously gets more complicated, but it's at a conceptual level. That's kind of how I think about it. There's a physician at Mass General Hospital made a comment about every hospital should follow every patient it treats long enough to determine whether the treatment has been successful and to inquire, if not, why not, with a view of preventing similar failures in the future. I thought this quote was something that really epitomizes me of what you're trying to do with big data. It's always learning from the data and always improving. Now, this quote happens to come from 1917, but I think it still applies today. When we think of big data and what's changed over time compared to the old school, a lot of it has to do with what I think of as 3 things. And I'm going to do a little bit of a quiz for you guys. The first is, does anyone know what this is? Take a look at it, see if you can figure it out. If you don't know, I will tell you. Yes, it's a clock, but it's a little bit more than a clock. It's a timestamp. In the old days, if you went on a train or something and they wanted to stamp the time, they might actually use a timestamp like this, so the date and time are imprinted. And the reason I put that there is because with all our AI systems these days, we're collecting data constantly, even when we don't know we're collecting it. Some refer to this as digital exhaust. So we have a lot more data than we ever had before because we're collecting all these various types of data as part of operationally doing whatever we're doing. It's every time you use an electronic system, every time, any sort, whether it's within your work or even a credit card or make a phone call, there's a big data exhaust that we're all creating, and that is a source of information for big data. So here's another question. What does this look like you do? And I think most people would look at this and say it's probably a face. I hope you can see that. You can see little eyes and see a nose. There's not much information here. The information appears to be kind of blurry because it's a low information. It's not a high resolution picture. But what is this really? Well, it's me. I basically just took a picture of myself and blurred it to show this example. But you can see when you see a high level image, the questions you can ask about it are just very different questions. You can ask questions about who exactly is it? What is their mood? And various other things that you couldn't ask otherwise. So by having data in more detail, you can just ask questions that can't be answered, asked with simple data. So here's something, see if people recognize what this is. Now, some might recognize this as a gene sequence, but the question then becomes, what gene sequence? And the answer is, it's a sickle cell trait. And what I'm trying to show here is that there's data that exists now that the humans can't even interpret, even if they wanted to. I showed this to a room full of experts, and no one at Harvard School of Public Health, and no one recognized what it was. And I wouldn't expect someone working in the field of sickle cell to recognize this. It's just too hard to interpret. So we need computers to interpret some data that for us is just unintelligible otherwise. The third type of thing I want to talk about, just understanding AI, is the generative AI, and that seems to be the hottest craze lately. And I just want to give a conceptual understanding of it, because I think it's relevant. In this case, if you start with something such as the phrase, "the sky is," computers are really good at turning that into a series of numbers. And each of the numbers can be thought of as a dots. And then when it takes those dots, it can apply math to those dots. Each one, that one gets calculations, and every arrow represents a calculation to a new set of dots. And then applies math to those dots to give a new set of dots. And finally, that results in an output, in this case, blue. The sky is blue. So effectively, you give inputs to the system, you get outputs. The logic on each one of these arrows is non-existent. What basically the computer does is just does effectively something similar to a trial and error, a little more sophisticated, obviously, until it figures out what series of weights on the arrows give it will allow them to take the sky is and result in blue. And then it changes the phrase to say what time is, and those same arrows need to now give it it. And it basically takes a whole bunch of time and effort to train these systems to be able to make these outputs. But effectively, the logic behind how it does that from an intellectual point of view is a bit of a black box. We don't know why it uses the math equations that it does, but it does seem to work. And this type of architecture can be expanded greatly. And ChatGPT is an example of how it gets expanded. So you can have 1.8 trillion parameters, trillion dots, off of 120 layers. It could take a long time to train and cost $100 million to train. And if you do make it big enough, it has emerging properties that cannot be predicted. You get fascinating responses to prompts that are original and useful, and you don't really understand where it comes from. But it is useful, and it is interesting, and incredibly valuable. And that's the third level of what I'm describing, is that incredibly useful stuff that is we're now learning to interact with now. So that's the basic understanding of what is AI. I want to talk a little bit about the current and future state of applying it, especially to healthcare and mental health. This is a study from 2003 from Medscape, and basically it's showing that providers are recognizing AI and recognizing the opportunities, maybe not fully utilizing it yet, but are basically seeing that can be used for treating patients, communicating with patients, diagnosing conditions, and the various things shown in this list. So this is something that's happening and it is being recognized, although obviously not fully implemented yet. This was a survey done at an American Psychiatric Association meeting, and it shows the degree in 2003 in which therapists, or psychiatrists in particular, recognize what AI is doing and can do in the future. So will already does improve diagnostic accuracy, will already does decrease disparities in healthcare, documentation is more efficient, and clinicians need more support training in understanding these tools. So in particular, let's see 80% say they need more training. So people aren't really, at least in 2003, hadn't adopted it yet, but they see what's coming. So what can some of these things do that are kind of surprising? Here's one of the examples. Here's ChatGPT performing on a board exam and doing better than the students, which is kind of surprising. It wasn't trained particularly on these exams, but yet it was trained on medical knowledge, and yet it was able to do better than the students. Here's one that was interesting, in which they had some providers, this is primary care providers, interact with patients through chat. And they had ChatGPT interact with these patients through chat. And they found not only did the ChatGPT do a little better than the physicians in terms of the clinical aspect, but they also did pretty well, did better than the providers in terms of empathy. And one of the thoughts is, obviously this is not how most providers practice. They don't practice through chat. And so it's painful to have to type everything you want to say in chat. But with the caveat, it's still pretty impressive that the technology did as well as it did. A lot of examples of what can be done in AI come from radiology, because radiology was the first department to go fully digital. This is an example in which an organization screens for COVID-19 pneumonia in patients entering the emergency room without a radiologist review. So it hastened the ability to get the patients into the right treatment. And there's an example of something that's a little unusual. I found this study in which the AI was able to recognize the race of the patient through the regular X-ray. Not something clinically most relevant in this case, but what it's interesting to say is that it can see things that radiologists may not be able to see. AI can interpret things that humans may not be able to comprehend. So how could it be used in mental health? It can be used in screening patients who need higher care, particularly seeing that for depression screening. Ambient clinical note dictation, and we'll talk more about that, but that's the idea that the system listens to a conversation, and just from listening, it transcribes the note and then makes a documented note from the encounter. Responding to patient messages, patients send in a lot of message, and a number of providers have work queues that they have to keep up in responding to patients, and the AI seems to be able to do a reasonable job at that, although the question is, how much do you trust it? Justifying a rationale to an insurance company. The system knows what this clinical situation is, and if a provider can basically type up a letter to the insurance company a little faster with some good references, that can be quite helpful. Just be careful that if you use it for that purpose, please check the references. There have been cases in which the system makes up references when it doesn't know them. So please check the references if you use it for something like that. Explanations in user-friendly language. I've heard examples in the emergency room where providers wanted to explain something to a patient and have a written document, and it asked ChatGPT or other language models to do that in, let's say, a 7th grade level or whatever it might be. So it can be used for that sort of thing, which saves providers time. You can give it very focused tasks to work with people on. I've heard it being used for mindfulness training. I've heard it being used for role-play exercises. I actually created one AI that did it not for mental health purposes, but for the work environment, to role-play having a difficult conversation with an employee according to a certain model of how those discussions should work. And potentially therapy, the cognitive behavioral therapy. And I'll talk a little bit more about that and what that means. So in terms of predicting the future, I think this quote is interesting. It comes from someone who just won a Nobel Prize for his work, particularly in AI and physics. And he said, I think that if you work as a radiologist, you're like a coyote that is already over the edge of a cliff, but hasn't looked down. So he does not yet realize that there's no ground underneath him. People should stop training radiologists now. It is just completely obvious that within 5 years, deep learning will do better than radiologists. And so that's a pretty credible warning that people should, that I think means a lot, especially coming from a Nobel Prize winner. The challenge is, he publicly stated this in 2016. So he is a little bit ahead of his time. I happened to find this article this week. Radiologist shortages will persist into 2055 without counteraction. So clearly he was wrong, and I don't want to pick on him too much because he's obviously a brilliant guy, and I'm not sure if I was in a situation I'd do any better. But I want to give him credit. But I do want to point out that people are making a lot of predictions, and it's hard to predict the future. As Yogi Berra said, it's tough to make predictions, especially about the future. So in that context, I thought it'd be interesting to show a study that just came out pretty recently, March 27th. Randomized trial of a generative AI chatbot for mental health treatment. So they did a randomized trial to see how well an AI chatbot did in treating certain conditions, particularly it was depression, anxiety, and eating disorders. And the quick result is it had a clinically significant positive effect. I'm not showing the data here, but it also something that the patients seemed to like. There was even a measure that they used for other studies to talk for how well patients developed a relationship with their provider. They used that same metric and showed that patients developed a good relationship with the AI. So that's a pretty significant finding. I should also point out in this that they screened out suicidal tendencies, mania, and psychosis. So they tried to limit it in certain ways, which may not be realistic for the real world, but at least for this, it kind of made it a safer study. They also had clinicians look at every one of the AI responses that went back to assess and make sure it wasn't making medical recommendations that it shouldn't have been making. But it's an example of where the technology is going. It's not there ready for prime time yet, but people are looking into this to see what it can do. So that's my thing about what the systems can do and where things are going. But now it's a question of what should it do? And in the ethical considerations, there are a number of things to think about. One of them is, what's the role of AI? And there are some situations which I think are just much more brittle than others. Is the AI making suggestions for you to consider? Is it screening patients in some way? Is that to show you the ones who you want to give a little more attention to? Or in the most one that's most brittle, is it ruling out patients that don't have to be considered, or ruling out situations that you don't have to consider? And I think as AI systems, the more autonomous they are and actually providing a comprehensive solution to a patient in the extreme, the more care must be taken to make sure that it doesn't make mistakes, and the more the ethics become even greater. When an AI deals with an expert in the field, for example, you can count on the expert in the field to know how to assess what's being suggested to it. And there are trade-offs. Sometimes you can't optimize for everything. You might want to do no harm, and obviously you want to maintain autonomy. You want to have equity and justice. You have to have responsibility for everything that's going on, transparency, confidentiality, and privacy. These are all important aspects. So I'd love to talk about more of these in detail, but as I prepared this talk, I thought what would be most useful is not talk about the ethical terms per se, but just come up with ethical scenarios or questions that I could present to the group. And this is not as much in ethics. It's not saying what's right or wrong. It's putting it out there for it to be considered. So 14 ethical questions. First, what must be done to protect private data? And it's kind of an obvious thing that protecting the data is critical, but how much effort needs to be done? How much needs to be anticipated about? One of the trade-offs is as organizations are often responsible for limited resources and allocating them appropriately. So you can never make something perfectly protected. So what level of protection do you put in? and when you put it in. So, for example, a lot of data falls under regulation because it's clinical data and you have to abide by the rules. But if you look at, let's say, maybe some of the well-being apps on the internet, they don't fall under the clinical rules. So they're not, at least legally, at least as far as I know, obligated to protect it in the same way that a lot of the clinicians are to protect their data. And how do we manage those types of situations? How informed must clients be about AI? In some cases, if the AI is being used behind the scenes, do they even know that their data is being passed through an AI algorithm? Do they need to know? Or if someone's interacting with an AI, there was someone who created was a company that was doing some counseling online, and they used a chatbot to do some counseling and didn't tell the patients. And the way it got out was he didn't think anything was wrong about it, so he actually did a post, and I think it was a Twitter post or something, where he basically talked about what he had done. And so, what are our ethical obligations to keep the patient informed about what we're doing with AI and how it might be affecting them? What are the risks of AI becoming a barrier to desired interactions? So one of my pet peeves is it used to be when you called a phone line, it said press 1 for this, 2 for that. You can always press 0 to get an operator. And AI has the ability to relieve some people from mundane tasks and give people a more immediate access to an AI system that answer their basic questions. And that will hopefully free up therapists to have more valuable interaction, maybe take over some of the administrative burden. But the thing we have to be careful about is, as things become more efficient and economically more feasible, we don't let the AI become the barrier to getting to speak to the people that we want to speak to. So how do we prevent that from happening, even though there might be financial incentives to do just that? When should clients be able to opt out of using AI? And I was thinking back when I'm old enough now that I remember when electronic medical records were coming into use, we had questions about should patients be able to opt out about having their data on an electronic system. But at some point, it became the standard of care. And now systems generally don't offer the option of a paper record. It's felt to be less safe and something that organizations don't even know how to manage. That may also happen with AI. There may come a point where, and I can think of an example where people are writing about doing a colonoscopy. They may use a AI system to make sure polyps aren't missed. If you don't use the AI, the provider may not feel safe or feel comfortable doing the procedure. So at what point does it get to the point where we don't give patients the ability to opt out? When do we and when don't we? Again, I'm putting it out there as questions, especially as this technology advances. Who's responsible for mistakes or poor outcomes? Generally speaking, you hear comments like, go ask your doctor. But if the AI system was designed by someone and it was designed inappropriately, is that system commit malpractice? Or is it the clinician who used that system who made the mistake? And how do we work out those issues? What is a reasonable expectation for preventing unanticipated consequences? And I use the word unanticipated on purpose because I don't think it's the same thing as unpredictable. I think a lot of these things can be predicted. We know, for example, that AI systems, especially the newer ones, have random errors, sometimes called hallucinations. We know that systems drift. So a system that is built and working and tested and works well today, 6 months from now, things might change and it may not work well, or it may not work in a different environment. We also know there's examples of systems having bias, where you ask the same question, give a scenario to an AI system and say Black patient, another scenario you say white patient, it gives a different diagnosis, or it doesn't always, but there are systems that have been built that do give different diagnoses. So we know these systems are can have problems. Now, some of these problems might be things that are not necessarily worse than the human systems that they're emulating, but still, what's a reasonable expectation for those building and using the systems to anticipate some of those things that go wrong and then work to prevent those problems? What are the cost implications? How much does it cost? What resources are being used for this that are being diverted from something else? And if some people or systems can't afford those costs, is that appropriate? Is that right? What's the basic level that everyone should have a right to? Who owns the data? That's in terms of building the systems, such as the lawsuit New York Times has, where they're basically arguing that their data is now being used for purposes that they never authorized, or even patient data. As we think about the business model of a number of companies, is owning the data, as in Facebook owning data that you might put on their system. And then sometimes this thing gets complicated if the company goes out of business. There's genetic data on 23andMe, and now that's owned by a company going out of business. What rights do the owners of that company have to sell that data? 9, what might it mean for a person to have a relationship with AI? Is it appropriate for a person to have a relationship with AI? What happens if they decrease their interaction with other humans as they get more and more engaged with an AI that they may find less threatening, more satisfying? I don't know. But it's something to think about in the AI world, especially if we're in a situation where we're encouraging people to use a particular AI tool. What does it mean that they use a tool for which they have a relationship with the AI therapist? In what situations should AI be able to justify its reasoning? So if it tells you something like you're not an appropriate person, your insurance doesn't authorize this, what does that really mean? But if the AI tells you it's not authorized, what does it mean? So what insurance right now generally has to explain it. There's usually a human saying, we have the following criteria, here's how we've decided whatever we've decided. AI doesn't always know why it decides what it decides. It doesn't have criteria. So when do we push AI to be explicit about what it says, and what does that really mean? How do you know when conflict of interest are inappropriately affecting AI suggestions? So Google makes suggestions because it's an advertisement model. And it's very easy to think about how someone could design an AI system to be biased in one direction or another, expressing a different value. There's an interesting report by Zach Cohen from Harvard Medical School in which he talks about asking an AI in a particular case of a child possibly needing growth hormone, at the prompt was pretend you're a pediatrician and give me the conclusion of should the child get the growth hormone, yes or no, and give me a justification. And the AI did a really nice job on that. But he then said, now imagine you're a physician working for an insurance company. Do you recommend it? Yes, no, and why? And it did a really nice job telling why the patient should not get the treatment. Now, if we use an AI system, we don't know how it's been prompted behind the scenes. But my point of this is there are commercial interests who would very much like to influence people one way or the other. I did a query the other day on AI, and I asked, given the following criteria, please rank which cars would best meet my needs, and why. And it gave me an answer. But you can imagine how under an advertising model, it can change the recommendations. Well, when might we be enabling continued suffering by not using AI? Everything I've said up till now has talked about how AI can cause problems. But the current system is not perfect. We don't have enough providers. People are not getting enough access to mental health care. And they're not getting particularly access to care maybe in the middle of the night when they might need care. So AI has potential to really supplement the system and be supportive and really make a difference in people's lives. And to some extent, if we're too careful about some things, we may be enabling ongoing suffering. Who decides what's in the best interest of various stakeholders? We may, for example, decide that something that a patient wants to do is not a good idea. But at what point is it such a bad idea that we're willing to, at least a societal point of view, say, this is something we need to prevent? What level of paternalistic control do we want to exercise in some situations, and other sides emphasize autonomy? And finally, the question is, what is sacred? Not all ethical decisions can be rationally decided. Some things, there's some good research on this, people feel are wrong, and they can't really articulate it. It's just icky. And what's sacred about the human-to-human interaction that currently is happening now, and how might we be messing it up by putting technology in there in such a way that makes things worse? So it's, again, one more thing to be thinking about in terms of as we judge our ethics. Now, I gave a big list, and I just want to say that's a little overwhelming, at least from my point of view, to even just listen to myself. So I wanted to just give some short things, take-homes from a therapist point of view. One is, remember IT privacy and security. There's some good regulations and some scenarios where it must be done. Follow them, protect privacy and security. Those regulations and laws are some of the best regulation laws out there. So make sure you protect the data. Two, review all recommendations. AI is not perfect, and if you review the recommendations and you see they're not right, you do what you think is right. And in this case, I tend to think of it as, imagine you're working with a student, a very bright student, who gets things sometimes really, really wrong. You are still a professional, and it's your responsibility to decide whatever you're deciding. You can't blame it on AI. Be careful with patient apps, especially ones where there's no professionals involved at all. There are some things that they're doing that might be good, and hopefully they'll be tested and make good progress. But when you're not there to see what's happening, it's hard to have full trust. Don't use AI to avoid patients, as I described earlier. It's not appropriate. And take advantage of the benefits that technology offers. The technology is amazing. It can make a difference. If I ask you, are we ready to trust AI? No. Are we ready to use AI? Yes. I use it all the time, and I think it has such incredible advantages. We really got to take advantage of it. But we also have to recognize the nuances of how not to use it appropriately. I did have one comment about ambient note dictation. I think it is a good example. This is where a provider and a patient have an interaction. The system listens to that interaction, makes a transcript. After it makes the transcript, it creates a note that can be used for the medical record, and then the provider reviews it and validates the note. It's a great use of AI because it saves time and it reduces mental burnout, because it just takes over a mundane task that the computer can do well. My point of putting it here is, it's great because the benefits and potential downsides are blatantly visible to the provider. Because if the note's not right, you can correct it. If it's working for you, you can see how much time it saves you. So it's a good example. The biggest risks that I see are those examples where AI is helping you in ways you can't see or you can't review, where you don't know if it gave you everything, where you don't know what decisions it's made. And if those things happen behind the scenes and something gets presented to you and it leaves important things out, those are the things that make me a little bit more nervous. So as a first case, I think ambient note dictation is one of the best uses of AI. And with that, I want to say thank you. And Mike, I want to pass it along to you for your presentation and interview.
Fantastic. Thank you, Dr. Brown. A really thought-provoking segment and a great transition into our next discussion. Just give me 1 second. And so next on our agenda, we have a great opportunity for a Q&A with Dan Block from Serene Living Counseling. Dan's a registered psychotherapist. And Dan, just confirming you are on the line, and we can jump right in.
I am on the line. Hopefully you can see and hear me.
Sure can. Thanks, Dan, for joining us. And so today we have a series of thoughts we wanted to put to Dan, but just learn a little bit about what he does in his practice, and also how he's starting to integrate and use AI and automation and technology, and get his thoughts on maybe where it's headed. So hope everyone's strapped in for this, and we'll get started right away. So Dan, if you're ready, I'd love to know a little bit about your practice. So Serene Living Counseling. I'd love to know what inspired you to establish the practice and what the core values are behind your approach to therapy.
Well, I'm going to spare everyone the super long background as to what inspired a number of life events, both tragic and fantastic. So let's take that as a summary for why I get into this line of work. Specifically, we established, so I come from the technology industry, so I guess maybe I'm one of your bipolar potential colleagues here. We, coming from the technology perspective, yeah, I've been excited for the advancements that can be made, and have jealously watched them happening on the physician side, and so was super excited, when CliniScript came in. What our therapy practice was established to do was to bring services to the local community that we serve, which is Burlington, Hamilton, and Oakville, to make them more accessible. So we do a lot of sliding scale work. We do work with the Victim Quick Response Program for those that have experienced either part of sexual or physical crime. And our role really is to work ourselves out of a job. So we try to do our work with the intention that we're going to exit, leaving clients in a better position than when we started, and as quickly as possible.
Fantastic. And obviously, with the increased demand for mental health services, accessibility has become crucial. We'd love to know how Serene Living has adapted to provide flexible options such as online therapy to meet the needs of your clients.
Yeah, so being a technologist and having worked remotely for almost 20 years, that part wasn't new for us. What was new was trying to apply those in a clinical setting. And so really COVID forced us to do that. We had done some, let's call it teleconference or telephone therapy for a couple of years before COVID-19, but COVID-19 really forced us to focus on being able to deliver it remotely. So we had to go from 2 locations down to 1 in order to be able to support it. So we closed 1 location during COVID and then really focused on finding the right set of tools to enable online therapy. And what we found is that gave us flexibility in terms of where we work from, and the reach we can have, the reach for clients who are on the move. It was also really beneficial from a generational perspective. Some clients just preferred to be remote. We never went so far as to provide it over text-only means like chat, but we did do both phone and video therapy, but it did mean some change. So for therapists, it meant learning to adapt to which senses you can use to read nonverbal communication, and a reduced field of view, in particular for couples or families where you can see much less. There's some adaptation that we've had to go through and understand. And then the other area, since we also treat screen addiction, is learning to determine when clients are multitasking or doing something else on the device they're using to have a session with, and being comfortable trying to address it and sort of bringing them back into the session.
Super. Thanks for that, Dan. And obviously, as you know, our topic du jour is AI, and obviously it's changing many industries. We'd love to know, how do you see AI impacting the field of psychotherapy? Your thoughts on how it's integrated, and how you are potentially using it today.
Sure. Look, it can have the initial reaction to AI can kind of depend on your perspective and your education, the experience you've had, from fear mongering of, all the movies that like war games that played into the risks of turning control over to a machine, to people who've experienced the tremendous benefits it can bring. So, I mean, I think, Michael did a good job sort of outlining some of the potential areas of concern, so I don't want to repeat them too much, but obviously privacy is a big one to pay attention to. And as Michael said, validating what we get from AI at this point in time is still really important. We're a regulated industry. We're typically quite conservative because a regulatory college encourages that and ensures that's happening. So that means we need to enter this, albeit cautiously, but also with being open to what it can provide, educate ourselves on what it can do for us, and then implement it safely. I mean, that was true also of implementing video to talk to clients remotely. There are platforms that were inappropriate, platforms that were appropriate, and met the necessary Healthcare Act requirements.
Great. And with the emergence and all the discussion around these AI-powered tools and apps for mental health. In what specific ways do you believe AI could be a valuable supplement to traditional therapy? And you've hit on a few of these, but what you might identify as some of the limitations.
Right. Well, again, as Michael alluded to, note taking is a great one. I first ran into note taking with my general physician who was using it, had been using it for about 12 months before I started to adopt it. And I was really excited about what that could mean overall for the industry, and some of the concerns about making sure it's not remotely in the cloud and it's sitting local on the technician's computer or laptop, helps ease some of those concerns, being able to eradicate any presence of the raw transcript that was taken and just taking the notes and appropriately storing them in a patient management system that's approved. These are all important pieces that we need to be aware of as clinicians to make sure that, we're still following the rules of the college. I think AI can really give us some benefits though. So in addition to the time savings, which I have to tell you, if you haven't tried it, it's amazing. What would be 2 hours of note taking after a long day of seeing clients, we're down to minutes. It's amazing. But yet you do have to read them and just make sure that some things don't need to be updated or changed. But overall, it has been very accurate. But it can lead to standardization of diagnoses. And, in Ontario, psychotherapists are not supposed to diagnose. That should come from a physician or in some cases from a psychologist. But even understanding the groupings of symptomology and then being able to understand, this might look like depression or this might look like anxiety, the consistency we could drive by having access to this major pool of information of different diagnoses that have been appropriately diagnosed, and saying, okay, just like the DSM-5, many of the particular mental health diagnoses depend on 5, 6, 7 criteria, and being able to have those compared to the DSM-5 and compare it to a really large pool of already diagnosed patients means we could drive some consistency, not only in how we diagnose, but also how we then treat, right? So being able to give recommendations of when you see these consistencies, these 3 or 4 therapies tend to be more effective. Understanding access to research data. So for example, depression and anxiety, we see overall better results, scientifically speaking, if sometimes medication and talk therapy are used, and being able to provide recommendations back to the therapist or to new therapists who are learning, or even, we're starting to see, I think, Michael, you referred to this, but we're starting to see AI robots doing situational learning, meaning they have enough information where they can react live to a conversation, so that as students are practicing, they could practice in a very safe environment before actually taking that to an actual client.
Super. And clearly, just to expand on that, obviously, Dr. Brown had a really thought-provoking segment on the ethical considerations. And what safeguards do you believe are necessary to ensure that client privacy and data security are being treated appropriately with these AI tools?
Well, sadly, I think there's inconsistency in the industry, even without AI, in terms of making sure we adhere to all the policies and requirements for the college. I mean, if we did a random survey of every psychotherapist, you want to take any bets on how many of them actually have an encrypted hard drive with the secretary and 2-factor authentication? I'm not going to hazard a guess, but I'm going to guess, I think it's probably not high enough. How about that? So, to some extent, we have these issues with or without AI. Obviously, maintaining the sanctity of personal information and health information is really important. And as medical health practitioners, we don't necessarily all have a super deep technological understanding. So if I were to kind of break this down in what was the term you used, Dr. Brown, grade 7 speak, I think. I would point it like this. There's a great case out there where some people who were coding at Samsung needed to solve a problem. They uploaded it to ChatGPT. They got an answer back. They put it into their solution, and Bob's your uncle until it came to light that all the intellectual property that Samsung thought was its own was in fact no longer its own because they'd uploaded it to a public AI brain, and hence now that was out in the public. It created a lot of issues around intellectual property. We have the same issue in healthcare, only more importantly. So there are ways to implement AI to protect data sources. And the way you do that is you take one of these brains or large language model, and you point it at sources to say, this is an authoritative source, this is an authoritative source, this is an authoritative source that doesn't contain personalized information. So for example, I can point it at the DSM-5. This is an authoritative source for how to diagnose. I could point it at a bunch of studies which have come up with certain conclusions based on certain parameters, as an example. I can point it to any kind of data source that's randomized and personal information isn't a part of. And then I can take symptoms from an actual client without identifying the client and tell that brain, hey, if these are the symptoms, what can you tell me about things I should look for? What would be the best treatment paradigm? Because we're not giving over private information. And that's they call it an architecture, the way that's designed. It's specifically called a retrieval augmented generation architecture. In the industry, they shorten that to RAG. And that provides some of the necessary safeguards to make sure that the mass learnings of AI don't take personal or private information or intellectual protection, IP information that shouldn't go out there, and keep it secure. Okay, and then we get all the benefits of what an AI can do for us while protecting the information. So if we do that, we can do it in a safe and reliable manner. I think it's going to be a crawl, walk, run scenario before we see all the possibilities of what it can do.
Amazing. And I just have one final question for you, Dan. And I think in a lot of my conversations, certainly with therapists, there's the conversation about human connection comes up. In your role, how do you see AI evolving alongside you as a therapist and the advancement of AI as a technology?
That's a really good question, because I think where AI has advanced to thus far, we haven't seen amazing examples of being able to generate something equivalent to the therapeutic alliance or a relationship. It's early. That's not to suggest that it can't or it won't. And we've certainly seen some examples of it successfully doing that in these sort of training modules or chatbots that can adapt and ask relevant and personalized questions based on the circumstances and the information gathered so far and compare it to other data sources. I think, though, we're just not at that point yet, and I can't tell you when that will be. And I, too, have no interest in trying to predict the future because I've never been good at it, and I'm not going to start now, because if I did, I would just buy lottery tickets. But what I would say is chatbots can answer questions or respond to questions or generate questions. What they can't necessarily do is adapt to the intuition or the emotional content or the nonverbal content. It's getting better. So, they have these Meta glasses now by Facebook and Ray-Ban that can look at a picture and determine what's in the picture and start to analyze it. I think that will grow, which in theory then, if you had video cameras pointing at a session, you would be able to read some body language and characterize it, but it's just far away. And until that becomes possible, I don't think replacing the therapeutic alliance is highly probable. Now, I did hear Dr. Brown say that there was a study done and people did react to chatbots and said, they felt like there was a relationship there. So I could stand to be corrected possibly. But being able to ask Socratic questionings and be fluid enough to be able to move means there is a lot of learning that AI still has to go through. So I think using it to harness repeatable actions like note-taking, characterizing symptoms, pointing therapists in the right way based on intervention strategies and tools, those are probably, for now, really good and possible safe ways to go. I think adapting it up to being able to understand the human emotion, the human experience, particularly with more challenging cases that don't follow prescribed outcome, like say grief. We know the stages of grief, but somebody can be at any stage in grief at any single time, and they can move from one to the other, and it's not sequential. So, you know, how do you sort of teach that to an AI model to be able to adapt? I think long way to go. Excited about where it is already and what it can do. I think developing an interpersonal relationship, that remains to be seen.
Super. And as we wrap up, I just wanted to thank Dan for being our feature here today for an awesome segment. And thank you, everyone, for this opportunity to speak on this topic, and Dan for taking center stage in this Q&A. Appreciate it.
No problem. My pleasure. Thanks for having me.
Thank you so much, guys. I know we have another minutes left here. So how about this? Maybe I'll pass it back to yourself, Dr. Brown. I know there were a few questions that were asked at the registration time. There is, I guess, if there's any questions, please, as I suggested, put them in the chat window. I'll try to put it out there so that Dr. Brown or Mike or myself can try to answer. So let's start with this. I think there's a question by Munir of how can AI be validated? So how can it be validated that AI response is 100% reliable in a given case? So Dr. Brown, you want to take that on, and while other people
Sure.
are.
Give my answer. Dan, if you want to chime in, that's fine too. My quick answer is nothing is ever 100% reliable. So I can tell you now that AI is not 100% reliable. I haven't met any human that is 100% reliable. So I think that is something I'd probably start with. Now, having said that, how reliable is it? And you can do studies. I mean, you can do randomized control studies to say in a population of people who meet a certain condition, this tool is however reliable it is. But it really, you're getting to a broader question which gets beyond AI, which is you can just show a drug tends to work in people who meet a certain condition. You can't tell if a drug is going to work in that given patient. You just don't know. And that's just not medicine. That's just not, I don't know, Dan, how you feel about it, but I think that's kind of you can never get to that level.
Yeah, I would echo your opinion. One of the things I've been watching very closely is, you know, the new saliva testing they're doing to determine which classifications of medications might have a higher propensity to work at an individual level based on their genetic characteristics. I don't know if that's going to be voodoo or science, but you know, if it pans out, that could, you know, that could be a great avenue of demonstrating that large amounts of data can tell us things. But absolutely at the individual level, that doesn't mean it's going to be accurate 100% of the time. And this is where your judgment has to come in, and you have to review things and make your own decisions. Do I agree? Do I not agree? And develop your own sense of confidence.
Thank you. Just 1 second add. So the only way to validate is probably a person should review and verify what's written actually is at least relevant, right? I mean, when a kid asks, okay, how we can make a layered cookie hard, so it should not be answered as a cement, right? So, you know, like, you understand what I mean. So at least the answer should be very, very relevant. Yeah.
Yeah,
thank you very much.
I would say,
yeah.
Even with the notes that comes from the CliniScript tool, it is so freakishly accurate. Okay, and that's kudos to the team that developed it. That doesn't mean that occasionally I don't change a few things because it's not my perspective of what should be said. But it happens rarely, like honestly, rarely. So, but still I check it, right? But my confidence increases the more and more I use it.
Thank you.
Excellent. Okay, there's a few other questions. I know there's a question where we receive a PowerPoint presentation and a certificate. Yes, you will receive a recording of the conversation. We'll point and store it on a website. Would you guys receive a certificate? And the answer is no. This is a free webinar that we are doing as a company, as we are focused on developing tools. So this is just for learning purposes. Having said that, in future we might explore. We are not a certificate provider. So that's the second question. There's another one, which is how do we ethically approach the fact that AI has a massive carbon footprint?
As a massive what?
How do we ethically approach the fact that AI has a massive carbon footprint? So, David,
Yes.
do you want to explain? Sorry, go ahead, Dr. Ram, if you understand.
No, that's a good point. That is one of the concerns. And when you hear the data on how large a footprint it has, it is shocking. That a good portion, I can't remember, like it's 9% or something. They're estimating 9% of the energy in the country will be due to AI. I don't have a good answer for that because I don't know if my not doing a query is going to change it very much. What I'm hoping is that there's some good and bad in that, actually. One of the things is the carbon footprint is high, so the dollars that get spent on it can also be high. And there's two ways of dealing with that. One is make an investment in alternative energy, and there are some of these AI companies that are looking to invest in building a data center next to a next generation nuclear power plant and pushing the technology forward in a way that actually might be helpful in the sense of they'll invest in the technology for their own purposes. Once the technology is advanced, it can have other benefits. Or there are other companies building it where gas is cheap. And if they build it where the gas is cheap, then it really is pure carbon footprint. So there are ways in which it can be pushed to be more carbon neutral and even carbon beneficial. But at the moment, I think the companies that are doing it they do seem to be talking about wanting to do this right. And I think one of the things when you build a new data center, you have to recognize it's not just the price of gas and oil now, it's the price of gas and oil 5 to 10 years from now. And I would hope that they would recognize that the renewables have a much better cost benefit footprint than the fossils do. And so over time, I'm hoping to make the right decision. It's a little bit challenging now because I don't think they're all doing that right now. They'll be a little short-sighted, but that's my quick answer.
Excellent. So we'll take a couple of more. We have a minute here. What approach? So Sarah is asking what approaches can mitigate the abuse of AI for less work on a therapist's part?
Say again, what approach can take for what? I didn't get
Can
that.
mitigate the abuse of AI for less work on the therapist's part?
Do you mean
If I
being
can
lazy and
clarify,
not
Go
reviewing?
ahead.
yes, I mean those therapists that especially starting up in their career, they hear AI and think, "Oh, I don't write notes." How do you work with them? How would you, as an organization, mitigate that approach to AI as instead of a tool that helps you be better, it's something that takes your job, the part of your job that you don't like, away?
Well, I mean, to some extent, if I understand the question, they're still responsible for their notes. And so they don't get to decide to not have a note written for their visit. They're still responsible for whatever's been created. And if they can do it in a more efficient way, God bless them. But whatever gets produced, whatever they click the sign up on, is their responsibility. And I think part of being a professional is taking the ownership for what's in your domain. And the visit, the encounter, and the note, even with the support of AI, is still irresponsible. If the AI says something inappropriate in the note, they are still responsible. There have been examples in which people have gotten into trouble. I mentioned the example of references not being there. I actually did some work where I found a few references for something I was working on were totally made up when I tried to follow up on it. There's an interesting case of a lawyer who submitted a legal brief and had fake cases in there. He never bothered to check. And he's probably, I didn't hear it looked like he was going to get disbarred for it. So those young professionals have to recognize that the AI is a tool to help make their life easier. It's their responsibility when they sign off on it. They're not just saying, yes, this is a note. They're saying, yes, this is a note. I'm putting my name behind exactly what it says.
Yeah. For those of you that use OWL, you click signature on when you close off a note. That means you're taking personal responsibility and liability for what goes in the note. And Sarah, I'm not going to ask how old you are, but 20 or 30 years ago, doctors, psychiatrists, even psychologists would see a patient They would dictate into a dictaphone. They would hand it off to somebody in the administration part of their staff who would create the notes that would go into the files. It was still the doctor's responsibility to go back and make sure that was an accurate reflection of his time with the patient. So I see that we can't blame the tool for humans not taking responsibility. We still have to take responsibility. In fact, we're held accountable by the college.
Excellent. And just one final question, whoever wants to answer, this is definitely a concern for a lot of people. How can AI impact our jobs in future? I guess from a therapist or a psychologist or psychotherapist perspective. So Dr. Brown, do you want to go first and maybe then Dan?
I think some jobs are going to be very much affected in a negative way where the AI will take away their jobs. I don't think therapy is one of those examples. I think there's so much that a therapist does that is going to be needed even more so. I also think there's an overabundance of people who need therapy. So I think in terms of jobs, I think the therapist will have a tool to make their life easier. I think there are certain people who have jobs, and if you have a desk job where you're given like a work queue to work through, then your job's in danger because AI is going to try to figure out how to work that work queue. I don't think a therapist's job is that predictable. I think it's the easy things will be automated first, and therapy is not the easiest thing.
Dan, your take on it, and then we can call it today. Thank you.
Well, I want to just say ditto. I mean, for those of you that are practicing therapy, you know full darn well that there's no way a machine at any point in time for the foreseeable future will be able to navigate the twists and turns, the argument that suddenly crops up between a couple, a parent-child situation, trying to navigate gender transition with a parent who can't accept, these are not going to be turned over to a machine anytime soon. But I do think that there are aspects of it that can be helped by machine learning and by AI, pointing us in the right direction to say, listen, these things look like this, to have us focus, okay, do these things look like this? You know what they do? And okay, these are the best tools. And, I practice 2 or 3 of these. Great. Those are great things. We can spend more time doing the higher value aspects of helping people and less time doing the lower value aspects of helping people. To me, that's a win.
Okay, perfect. Thank you, guys. I know we're 4 minutes over. I really appreciate everybody's engagement, especially Dr. Brown, your presentation, Dan, your presentation and your engagement as well, and everybody else who's asked the questions. So perfect. Thank you, guys. We will definitely be sharing the recording soon. Thank you, everybody.
Thank you.
Bye-bye. Thank you.
Thanks, everyone.